Good morning, everyone. I might get going now. I'm still waiting on a few people, but they can join us when they jump on. So welcome to the Concussion in Sports webinar. My name is Alison Alari and I'm the Injury Prevention Officer here at Injury Matters. Oh, what happened there? Oops. There you go. Okay, so bit of a little technical glitch there. Wouldn't be a webinar if something didn't go wrong. So I'd like to start by acknowledging the traditional owners of the land in which we meet today, the Whadjuk Noongar peoples, and extend our acknowledgement to the traditional owners of the land in which people from across the state are attending, and pay my respects to the elders past, present and emerging. So before we get going, just a little bit of housekeeping. We would love to hear your questions. So I strongly encourage you to please send them through the Q&A chat function, and we can go through them at the end of Sarah's presentation. If you have more than one person in the room listening to today's webinar, can you please send us a quick message or private message via the chat tab to let us know how many people are listening in with you. And also, once the webinar is finished, a survey will pop up. It's a SurveyMonkey survey. If you can please take a moment just to complete it. All your feedback helps ensure that we're delivering training that is relevant to your needs. So a little bit about Injury Matters. We are for safer people and places. Injury Matters aims to prevent and reduce the impact of injury within the Western Australian community. So we do this through advocating and providing education for injury prevention, as well as providing support for those who have been impacted by injury. So today's webinar is brought to you through our No Injury program with the support of the Department of Health WA. No Injury is a statewide program which aims to enhance the capacity of injury prevention and safety promotion practitioners and organisations such as yourself to deliver quality injury prevention activities. So No Injury does this through providing training such as what the webinar we're delivering today, resources and networking opportunities. I'll go into a few more of those details after the presentation. So looking at concussion in sport, sport-related concussion is a public health concern in Western Australia and affects athletes at all levels of sport, from kids in community sport through to professional athletes. If it's diagnosed and managed appropriately, most symptoms and signs of concussion will typically resolve. However, complications can occur and there's growing concern about some of those long-term consequences of multiple concussions. So looking at the incidence of sport-related concussions, specific data in Western Australia or even Australia is lacking, which could be due to the lack of recognition of symptoms, underreporting by athletes and clubs, as well as people not seeking medical advice or treatment. So in Western Australia, the Royal Perth Hospital Trauma Registry collects data regarding trauma patients who present to RPH for treatment within 7 days of obtaining an injury. So Royal Perth Hospital have reported that between 2010 and 2019, they reported 991 sport-related injuries due to the head or the neck. So as health and fitness professionals, local government, community sport, high performance, or even research and academics, we all have a role to play in reducing the impact of sport-related concussion, whether that's through education and prevention, evidence-based policy, through to recognising and managing concussion and return to sport. So today's presentation will be provided by Dr. Sarah Harris, who will provide an overview of sport-related concussion in Australia. Sarah will be looking at some of the long-term consequences, assessing and managing a concussion, as well as a return to sport. So I'd now like to introduce you to Sarah. Sarah, let me go back one step. Sarah is a postdoctoral research fellow with the Australian Centre for Research into Injury in Sport and its Prevention. After completing her PhD in 2019, exploring the association of concussion and mental health outcomes in Australian footballers, Sarah joined ACRUS to continue her work in concussion and injury prevention research. Sarah is actively involved in the WA sports medicine community through her previous work in Australian football and as the WA State Chair for Sports Medicine Australia. So I'll now pass you over to Sarah. I think, Sarah, if you share your screen and take that off me.
Excellent. Thanks very much, Alison. So today, well, that was an awesome introduction. So today we're going to chat about concussion in sport. Now, a little disclaimer up front, I'm very excited about concussion. And so I have my timer in front of me and we'll try and stick to time as best as possible. And I'm sure I will get a little tap on the shoulder electronically if I get a bit excited going down a tangent or two. Please put your questions in the box as we go, and then I look forward to having a discussion at the end. So just to start, I'd just like to also do an acknowledgement of country so that we acknowledge the traditional owners of this country that we each are standing on today and honour the elders past and present. So let's get started with a little bit of footage.
It's real. Yep. And when you're not expecting all belly, I think you're absolutely right there. And it's great awareness and sportsmanship. There's the hip at the end.
There's Atkins, not going to go that fast. Sloan starting to get his hands on the footy. Good tackle, Kent.
Let's have a look. Oh, yeah. Head bounce off the ground there. That
And he... Jeremy Cameron.
Bring it in. Short, well, not short enough as it turned out. Sell with wonderful courage in that route. And Ray turns side on almost, doesn't he?
Well, if both of the balls between them, you can't.
Yeah.
That's just a genuine two blokes.
Okay, so that is concussion. If you didn't know what you were here to watch today, these are the kind of things that we're talking about in sport, and unfortunately it does happen more often than we would like. So concussion is considered a mild traumatic brain injury on this spectrum of minimal all the way up to severe traumatic brain injury. And concussion accounts for approximately 90% of all TBIs that we're actually going to be seeing. Sport may get a lot of publicity, but in terms of mild traumatic brain injuries or concussion, sport actually isn't the leading cause of concussion. So it only accounts for about 10% of all of these MTBIs that are occurring. The majority of others come from falls or road trauma or from domestic violence cases. So concussion is defined as a complex pathophysiological process affecting the brain induced by traumatic biomechanical forces. So what does that mean? You've got your brain and it's inside your skull. Either a force is exhibited to the body via whiplash, causing the neck to move, the skull to move, and therefore the brain to kind of rattle inside, or a direct force is actually applied to the skull, causing the brain to rattle inside. Either way, the brain is being shaken around inside the skull and it doesn't like it. So it's going to cause some kind of minor trauma through to major trauma. And this is how we distinguish between that concussion through to that severe traumatic brain injury. So when we have a look at this image, we can see that through that movement, there's certain spots that are lighting up. And this could be just a temporary disturbance that occurs, or in some cases, this could actually lead to ongoing issues. So when we kind of think about concussion, we often think about these short-term things. So perhaps that'd be a headache, balance, dizziness, maybe emotional. So being a bit more emotional, nervous, irritable for no reason. Or perhaps from a cognitive point of view, so feeling foggy, just not feeling quite like myself. And you might hear these terms used in sports, such as a bell ringer. So you might have ringing in the ears, or punch drunk, where people might look like they're drunk and they're not actually able to have those motor skills they normally would have. So short term, those things would normally go away within 7 to 14 days. In some cases though, they can be persisting. The concern is that with repeated concussion or severe concussion, perhaps the damage to the brain that we see as temporary could actually be causing long-term damage. There's still a lot of research going on in this area, and depending on who you speak to, there is conflicting evidence as how much does the actual brain trauma contribute versus other social or genetic factors. But some things that we might see long-term include irritability, decreased concentration, memory loss, decreased in impulse control, cognitive impairment, perhaps aggression, and the one that is thrown around quite a bit is that chronic traumatic encephalopathy, or CTE. So concussion has been announced as an international public health priority area. Oops, come on. Sorry, we'll give it a second to catch up. And so since starting in about 2014, the knowledge and the interest in this area has increased exponentially. And this is a lot to do with the press that's come out of America. Given the long-term effects that concussion could potentially have and how difficult concussion can be to diagnose, this causes concussion to be quite a complicated issue to discuss. So unlike a broken leg, in many ways, concussion is actually a hidden injury and can be quite challenging to diagnose and to monitor and to follow up. Another challenge that we face is in sport, how concussion is diagnosed, how the data is collected, how it is defined and how it is reported varies between codes, between countries, and even within these codes themselves. So a few different ways that we can talk about incidents is in terms of new injuries per club per season. So for the AFL in the 2017 injury survey, they reported that there was 1.46 concussions per club per season. So you'd think that's not very many. But another way that we could look at concussion is per athlete exposure, where one practice or game equates to an exposure. Now these numbers are provided from America, as athlete exposure is quite a common method used in American sport incidents reporting. So in this we can see that in men's rugby, there was 3 concussions per 1,000 athlete exposures, with that decreasing down to men's football at the bottom. But then there's a third way we can look at it, and this is concussion per 1,000 playing hours. So this is a little bit different in the sense that it's counted per player match hours, and you'd obviously have, say, 2.5 hours per game, or depending on how long you're actually on the field for. And one study that came out by Gibbs and Watsford indicated that in one team, potentially there's 17.6 concussions per 1,000 playing match hours. So as you can see, there is a lot of different information, and it does make it quite challenging to compare between codes and to identify what is the true incidence of concussion. Another spanner we can throw in the works is that if we define concussion as a player being required to miss a game, as it has been done in the AFL injury report under section A there, this may actually exclude a whole lot of players who were able to play the following weekend. And it's been shown that in this case, they actually estimate that number to be a little bit greater at approximately 6 to 7 concussions per club per season. So as you can see, it all comes down to how do we define the injury, how we collect the data, and how we report it to actually try and work out what is happening in all these different sports. So one form of information we do have is the hospitalisation data. So if we look back to 2012 to 13, which is the most recent data that we have, there was an average cost of $5,300 per case, with head injury overall having the greatest total acute care costs of all type of injuries presenting to hospital. In this case, concussion specifically contributed to more than $4.6 million of these costs within the public health sector alone. If we look at over time, we can see that there's been an increase in the number of head injuries requiring hospitalisation. Seeing this, it either means perhaps more people are aware and more people are therefore presenting to a hospital, or perhaps it may mean that there's actually more head injuries requiring hospitalisation occurring. It is hard to try and distinguish between those couple of cases. Either way, we are seeing this trend. And as we can see, that kind of coincides with the 2014 information coming out of America, and a lot more publicity coming around concussion and head trauma. So there's lots of different studies looking at in sport what may predispose or put a player at risk of concussion. There's still a lot of contention around it, a lot of research conflicting information. So what are a few main things? We know pretty certainly that having a previous concussion can make you more at risk of future concussion. We know that potentially males are more at risk than female. There's also things to do with age, genetics, perhaps their behaviour. Different studies have looked at game dynamics and environmental demands. However, there is a bit of conflicting research. So for instance, does the first quarter versus the last quarter lead someone to be more at risk? Does the position they play on the field match versus practice? Perhaps the level of the game. So is it a final series versus just a pre-season scratch match? And then also those kind of personal demands. So what did they have in pre-season? How fit are they? And what actual equipment are they wearing or not wearing? So attending today, I thought what we'd do is actually take it through and look at role in sport. So with the role in sport, there's 5 R's of concussion that we can consider. So that's recognising a concussion, removing a player from the field, referring the player, rest, and then that return to sport stage. And so that's how we're going to break up the next part of the presentation. So the first stage we want to do is recognise that a concussion has occurred. So the first few things that you might notice immediately afterwards is that the player potentially could be unconscious. They might have had an awkward landing. You might notice a fencing response, which is this image down the bottom, and you might have noticed with Joel Selwood in that last clip of that first video I made where that kind of arm went quite tonic postured. So that rigidity that we're seeing is a neural response trying to protect the body following the concussion. Perhaps you might notice that as they try and stand up, they're quite unstable. Immediately post, you might notice they might hold their head, check for blood. Perhaps they might report they've had blurred vision. They might seem disorientated. The number of times you might see a player get hit and they grab the ball and turn the wrong direction. Perhaps they might fend off people, seem a bit irritated. And afterwards, you might see more of these kind of symptoms start coming out. And these are the ones we really rely on the players to actually verbalise and to tell us. They're often a lot harder to actually observe, especially if you're not familiar with the player. So these are things such as headache, dizziness, blurred vision. Perhaps they might seem spaced out. They might say they're foggy or just not feeling quite like themselves, or they might have trouble trying to remember. So the most common game day scenarios that you might encounter, kind of the easiest one to distinguish is the player is actually unconscious on the ground. However, only less than 10% of concussions will actually lead to a loss of consciousness. So we can't be relying on this metric to define whether someone has concussion or does not have concussion. If a player is unconscious, it's quite a clear-cut, dried scenario. We perform our Dr. ABCD. If you suspect a spinal, you either call an ambulance, or if you have the appropriately trained staff and you feel that you are competent, you can operate a stretcher to remove them from the ground. If there is no doctor at the ground, then as a sports trainer, a physio, or someone else that is there, you need to take charge of the situation. Remember that at the end of the day, the game can wait. And it's amazing how many times people will try and rush through thinking they want to let the game continue. The game can wait. So if the player is conscious, this can be when it becomes a little bit more challenging. So I have an example here, and we're going to be watching one of the players.
Once again, looking for Howard. Davis with the 4 fouls. Howard blocked from behind by Robinson, and Daniels picks it up. Great help defense from the littlest guy on the floor. And Davis is down. Right now it's 4-on-5. Davis slow to get up. I think Davis is, boy, he's struggling with his balance right now. He is shaking up big time. Joe Crawford trying to help out there. Boy, Davis looks a little disoriented.
They've already taken their 20s, so this has to be close.
Davis can't stand up by himself right away. It took him a little time. See Doctor out there along with the trainers. Goes down, didn't hit his head, but landed funny. They're saying to bring out water. Maybe dehydration. You hope it's only something so simple like that when he's dehydrated. But right away you can see him. When you saw his eyes, he just looked disoriented as he couldn't get his balance.
Yeah, he was slipping.
And he's still down on the floor. Obviously dizzy there. So we'll take a break. As we wind down the third quarter, they attend to Davis. Right smack in the face. Joe who got hit. Joe Crawford comes up and does a good job.
Sorry, I'm just trying to get it to skip screens for me. Excellent. So as you can see, he has struggled. He hasn't become unconscious. As the commentator said, he hasn't actually hit his head on the ground. He did do a bit of the tonic posturing. You saw the arms went quite rigid. And then when he went to stand up, he kind of had a bit of that Bambi young kind of animal action where his legs didn't quite seem to work and his legs got a little bit faster than what his body could actually manage. And he ended up being caught by the referee. Interestingly, if you could hear the commentary, they were saying, well, he didn't hit his head. Hopefully it's just a bit of dehydration and he'll have a bit of water and he'll be back up and fine again. And the rest of that clip actually shows the coach telling him to hurry up and to get back on. So when we're having a look at this, that is a clear example when a player has concussion but hasn't actually been unconscious. Now, if you were busy and didn't actually see that at the time, it may be challenging to actually know what's going on, but you did see kind of how blurred he was and a little bit fuzzy and did look quite dazed. The next kind of case that we may get is hit and we see blood. Don't get distracted by the blood. Quite often, my experience working in sport is that a player will come off with a blood nose and there's so much fixation on fixing the blood nose and getting them to return to play that we forget that if they've had a big enough hit to their face to cause a blood nose, potentially what's happened to their brain, which is sitting behind that in that skull. Now, I'm not saying every blood nose means concussion, but what I am saying is that if there's been enough force to lacerate an eyebrow, to cause blood in the teeth or the nose, maybe just sit them off for a little bit and ask a few extra questions just to make sure they don't also have a concussion. It is easy to get distracted by that blood that we see. Now, the hardest one that we come across is when someone gets hit, they go down, they get up and they continue playing. It's challenging because how do we differentiate between just a head hit, something that might be subconcussive, versus what actually is a concussion? These are the hardest to observe, they're hardest to follow up, and these are definitely one of the ones that are hardest to manage. So when you're having a look at one of these, it's always best just to check in with players and just be attentive to know if they do say, oh, suddenly I've got a headache. Or the more common one is when someone comes up and says, I just need 2 Panadol. So be aware, and it does help if you do know your playing cohort. At the end of the day, if you do have any doubt if someone has concussion or not, sit them out. There is no harm in them missing the rest of the game, and it's better to be safe than sorry. But I do know from first-hand experience, it is very easy to say, just sit them out, versus actually getting someone who may or may not be concussed to just sit on the sidelines the rest of the game. So that brings us to the next stage, which is removing someone once we suspect that concussion. There's multiple different ways. At the top right, we can see he's being helped off the ground. We've got someone being put into a spinal care position or someone being stretchered off the ground. This all comes down to your capabilities and what your training is, so that we always emphasize do not act with outside your scope of practice. And if that means stabilizing someone and calling an ambulance and the game is called off, that's what needs to happen. We then talk about referring a player. So that can happen in 2 different ways. There is a concussion recognition tool, or the CRT5. This is for any person, they do not have to be medically trained, to help identify concussion in children, adolescents, as well as adults. So this is a little card that you can keep in your kit. It's easily downloadable, and I've got a link to all these at the end. And it actually steps you through how you can identify someone that has concussion. So in regards to the refer stage, you might actually be the person doing the referral. You can have a look and go, are there any red flags? What are some observable signs? Some symptoms they might report. Let's have a look at a memory assessment. So what venue are we at today? And then it's got a little summary down the bottom telling you that athletes with suspected concussion, what they should or should not do. So in regards to when we're looking at this section, you're able to, any person can administer this, that's the idea, but this does not diagnose a concussion. So in regards to refer, you may need to refer someone either to an ambulance, or you may need to refer them to a medical practitioner to have a SCAT-5 done. So the SCAT-5 is for medical practitioners to run a more thorough assessment. Or there's a whole range of other assessments that can also be done by someone who's qualified. This might be a physiotherapist, a sports doctor, someone in ED, a general GP, or a vestibular physiotherapist. These things could be a brain CT scan or an MR brain scan, not very common unless you're actually thinking there's a skull fracture or a lesion. An fMRI, also once again, not very common unless they are thinking that there could be something going on electronically within the brain they want to have a look at. 2 of the ones that are becoming more common are the neuropsychological tests. So this is looking at a person's cognitive function, and actually is being performed by a lot of high performance staff in football and in other teams. So for instance, they might do something called a cog state, which looks at your reaction time. The intent of this being, if you've had a concussion, perhaps your memory might be delayed, perhaps your reaction time might be delayed. And until you recover, there may be those deficits. So these tests are often performed at baseline and are then performed again following the concussion. And then they're performed again when they think they might be fit to return to play. King-Devic is another test that is used often by vestibular physiotherapists and might also be used by sports doctors. And the aim with that is detecting ocular motor changes. So trying to have a look at how the eyes track, with the thought being that if things aren't processing properly, you're going to be having deficits and you might actually see the eyes jumping around. There's also other ones that you might hear, such as the mouthguard force detection, which is a mouthguard that sits in the jaw, and it detects different numbers of force, whether it's linear or accelerational force. The issue with that being is in a sport like AFL, where it just sits in the top, or like basketball, if a player moves it, chews on it, anything like that, that's going to be registering false numbers. The other issue is we currently don't know what the cutoff of force is to elicit a concussion. So assumably, the greater the amount of force experienced is linked with a higher chance of that being a concussion. But there's still cases where people could be hit with a really low number and be completely apparently fine, or hit with a higher number with a higher force and actually not be, and then they might be completely okay. So it is very hard to differentiate between that force line. If we had a magical force number, that would be amazing. And some different studies do use a median force to try and group people, but to date, there is no cutoff that definitely confirms you are or are not concussed. So there are a whole range of different assessments that are available. Now, when you are referring someone and you're assessing someone, be wary that, especially in sport, there are lots of different barriers to reporting. Now, in sport, often we glorify risk, we try and normalise pain and injuries, and we often reward people for playing hurt. So it comes at no surprise that then people, when they get injured, don't necessarily want to be honest and miss out from playing. Now, primarily this could be they just don't physically recall the physical signs, they don't realise. Perhaps it might be the fact that post-concussion symptoms actually can be delayed. So you might not notice them at the time of incident, but perhaps might appear 12 to 24 hours later. Or perhaps they don't realise that post-concussion symptoms actually include more than just a headache or dizziness. It could actually include emotional symptoms. So things like a feeling of depression, feeling really flat, feeling irritable, all for no known reason. A 2013 study looking at American high school footballers found that 66% would continue to play even if they identified they had a concussion. 33% said they'd take just a short break and then continue. So as you can see, if we put those numbers together, a very, very small minority would actually remove themselves from play. So why do players not want to report? And this is for both males and females and can cover a whole range of different ages. First of all, that fear of being withheld, so they don't want to miss out. They want to keep playing. They don't want to be labelled soft. And this all comes back down to this stigma we put around athletes of being tough and putting their body on the line and celebrating all these hard hits and sacrifices they make. They might think, oh, just a headache. It's not serious enough to report. I don't want to report that. They might just not recognise that they have a concussion, whether they be too swept up in the game or just not be educated and know what's going on. Or quite commonly, and we even heard it in the video before, mistake the symptoms for something else. So after the game, think, oh, I'm probably just dehydrated. That's why I feel a bit off. That's why I've got a headache. That's why I feel a bit dizzy. And then it's only a couple of days later when things still aren't quite right that perhaps they bring it to the attention of someone. And a nice quote from Chrisman 2013 says, kind of sums it up. The coach says, don't play if we're concussed or injured. But when I report an injury, the coach questions if I am sure, can I not push through it? So we need to take into account the influence that coach attitude, and even with kids, the parents and their peers, and that approachability and that willingness to kind of change the stigma and that conversation around it. Because these can potentially really influence people reporting and getting help, and also being willing to abide to the return to play that we'll see in a moment. I must admit though, over the last kind of 5-6 years that I've been working in concussion and sport, there's definitely been a mindset change. The stigma is definitely decreasing, and a lot of coaches and players and even commentators are changing that discussion, that language they are using, which is really promising. But in saying that, we still do have a long way to go. So once a person gets concussed, their brain has an injury. It needs to recover. So we need to elicit some kind of rest. So with that rest, the old school way of thinking was you go sit in a dark room, but don't sleep. Sit in a dark room, don't read, don't watch TV, don't play video games, just sit in a dark room and rest until you feel better. Now, we've learnt that yes, while rest is really good, sitting in a dark room for a couple of days by yourself probably isn't going to be the best for your mental health and your recovery. So now rest has been kind of loosened a little bit. So what that means is don't drive, don't drink alcohol, don't watch a really exciting movie, don't be socializing in a big room. Chill out at home, watch Netflix, watch a movie you've seen 1,000 times, get some rest and some downtime. Don't sit on a screen all day, as that's going to put strain on your eyes and exacerbate any symptoms that may be there. So just actually rest and, for lack of a better term, just chill out for 24 hours and then start looking at how you are recovering from there. We can then look at the return to play process. So rest is actually the first stage of this 6-stage process. Once someone's been asymptomatic for 24 hours, so no signs or symptoms, whether that be old or any new ones occurring, then they can progress to the next stage. If any symptoms do develop, whether that be the old symptoms reoccurring or new symptoms, then they have to return to the previous stage. It's really important to note that during this whole return to play process, no, you can't be taking medications to mask symptoms. And I know that may sound really obvious, but the number of people you find out are still having Panadol or things like that because they've got a headache, not ideal, unless of course you are under the care of a doctor and they have administered it. With children, it's also important that they return to school first before they look at returning to sport, but I'll go into that in just a second. So our 6 stages, that first stage is our no activity. So that's our rest stage that we were just talking about. Chill out, take a break, limit screen time. Next involves light aerobic exercise. So go for a bit of a walk. If you've got a stationary bike, go for a ride. Don't go for a huge run. Please don't jump in the pool. Don't do anything that if your symptoms flare up, you could be putting yourself at risk. So don't go riding a bike on the road, etc. Just a nice casual walk with company around an oval, etc. 24 hours later, if you are okay, then you can resume sport-specific exercise. So what this means isn't you get to go do full training. If, for instance, football, which is what my background is in, you might be doing handballs, you could be doing stationary kicks. You could actually start doing those skills. And if you feel okay, after 24 hours, then you can start doing that non-contact training. So that's joining in with the drills at football training that involves, say, running. You can be starting to join in the handball drills and those kind of things. So whereas the sport specific is by yourself, non-contact, you can start joining in with the group. You then need to be medically cleared. Now, I know that this is a challenge for people who don't have access to sports doctors and doctors at their disposal. I know this is a challenge if you're in country and rural areas. So a medical clearance is highly recommended. This is the best practice protocol that we have to make sure that you are okay before you then resume full contact training. Full contact training, you must be able to complete a full session. Afterwards, you won't be returning for greater than 7 days to sport. So if you have a look at the Ecommendia, it's the consensus statement that I've got down the bottom here. They do actually have a full return to play summary, talking about how do you actually do each stage and what is the goal of each step. Between step 3 and 4 is kind of the earliest that you'd be looking at recommencing any kind of weight training or resistance training. And that's often a question that we get asked when people get told they can't do much. So 3 and 4 is when you look at your resistance training being added in. With school, I'm going to use the AFL example. They state that a concussed player must not be allowed to return to school or to return to training before having a medical clearance. A lot of schools will actually have their own policy, so just double check, but generally it's pretty consistent with this policy. But the priority is a person must return to learn or return to school before they are returning to sport. So notify the teacher to let them know what's been going on. You might need to limit screen time. You might need to break up the day. And of course, cease any activity which causes or exacerbates symptoms. May I also emphasize that when we say return to school before return to sport, that also means school sport during school hours and playtime, which I know can be really hard getting some kids to sit still, but perhaps may just need to look at how you break up the day to be able to get this to be possible. So there is a return to school summary that looks at getting them to do daily activities first. So that's their gradual return activities, normally at home. Then get them to do some school activities, but perhaps outside of the classroom. So there's not all that noise and kind of confounding factors going on. Then look at returning to school part-time. Then look at returning to school full-time, with a minimum of 24 hours between each stage. Now, depending on the child, you don't always have to skip straight 1, 2, 3, 4. You may actually be able to skip stage 2 and go back to returning to school part-time and then full-time. Once you've returned to school full-time, that's when you then commence that return to sport procedure, starting from step 2. There's lots of different resources available out there, and that can be really, really good, and other times that can make it a little bit confusing. So there is one central resource for sport, and this is this collaboration between the IIS and Sport Australia, and this is the Concussion in Sport module. So on this website is a whole lot of information for athletes, parents, coaches, and medical practitioners all in one place, and just provides a nice brief overview of what to do. There's also the AIS and the AMA Institute of Sport position statement, which is a lengthy document which goes into a whole lot more detail. So if this is something you're quite interested in, or you're assisting your club with writing up a concussion policy, I'd highly recommend reading through this document. There's also a lot more helpful resources, for instance, the consensus statement. It's free. And it's available at these links, which I'll give to Alison to make sure everyone can get access to. There's a SCAT5, which is the tool that I was talking about that a medical practitioner can administer to assess a person for concussion on the side of play. And once again, that is a free link. With this consensus statement, it was due to be updated this year, but it's now going to be revised next year just due to the conference being delayed due to COVID. Other tools that I probably think are quite helpful is that sport concussion tool. I think I just put that on. Oh, sorry, that was the information versus the actual tool. The child SCAT5, so that's for anyone aged 5 to 12 years. Or that concussion recognition tool, which is the one that we spoke to that nicely kind of gives you an assessment tool just to be able to work out, do you think someone needs to sit out? Do you think they need an ambulance? There's also a lot of sport specific information. So first of all, if you're not sure who to go speak to, in terms of health professionals, sport doctors, neurologists, neuropsychologists, and vestibular physiotherapists can be really helpful and all have their role. In terms of general sport, Sport Medicine Australia also has concussion information, and the American Medical Society also has their own position statement. Australian football, ice hockey, basketball all have their own community sport concussion guidelines. Combat sports, there is an international consensus statement speaking about how people should wait or return to play. Cricket and equestrian also both have their own statement, as well as football, gridiron, gymnastics, netball, softball, and water polo. Other sports may also have them. They're just potentially not as easy to access when I was having a look to compile this list for you guys today. With rugby, rugby actually has guidelines that stipulate based on your age how long you have to wait before you can return to sport. So if you are involved in rugby, just double check, as it is something along the lines of under 19s have to wait 21 days before they can return to sport, and over 19s, I'm pretty sure it might be 7 to 14 days, but please don't quote me on that one. So they actually have a little bit of different rules in place, and I do believe you need to provide evidence that you have been diagnosed and then you are cleared to play. There's also the CREST study, which is currently being run out of Perrin Institute, which is recruiting for anyone who's recently had a concussion injury. So what they're looking at doing is not only looking at what happens at the time of injury, they're then going to be following people up. So if you do know anyone who's 18 to 65 years, it doesn't have to be a sports-related concussion. It can be any other kind of concussion. If they can contact the research team within 7 days, and the website's down the bottom. Now, just a declaration, I'm not involved in this study in any way, shape or form. I'm just aware that it's going on and they're currently doing recruitment for it. So what can we do? Concussion, especially in sport, is going to be really hard to prevent unless we change the rules or we kind of start looking at not playing, which we know isn't entirely possible. So we need to look at things like early treatment so that we can educate, raise awareness. That way we can early identify when someone has a concussion, and then we can actually have some kind of intervention. And if we can do this, then hopefully we can get people staying as healthy as possible, sitting out for the required amount of time, but also getting back to sport as quickly as possible. Any questions?
Great, thank you, Sarah. That was a really great presentation, and you can see your passion for the topic coming through when you present. If anybody has any questions, did they want to send them through on the Q&A function? It should be on your Zoom toolbar. I have had a couple come through, so I'll get the ball rolling. What is the next step for sport? What do you see the next 2 to 3 years looking like for research and care?
I think at the moment it is looking at how we can diagnose and work out when someone is fully able to return. So at the moment, kind of the best practice that we have is that we know that when someone's asymptomatic, then we look at them starting to return to sport. But new evidence has come out saying that perhaps just because they have symptomatically recovered, perhaps there's still cognitive lag and actually cognitive damage that is recovering. How we measure this is we still don't have the best techniques. Depending on what access you have to resources, some people have better access than others. Mm-hmm. But if we're talking about in a community sports setting, often you're kind of just going based on what the person is telling you and how they're presenting and the advice of doctors. The other issue is with things like the COG state is it relies on players accurately completing it at both occasions. And there became evidence of players completely stuffing up their first round and bombing it in the hope that if they were then concussed, their scores wouldn't look too different. Mm. So one thing that we need to be wary of is there's a whole lot of different metrics and information and things coming out, but what actually is helpful for your environment and how can you do it and be consistent and actually have the information be helpful. So going forward, I think it's definitely going to focus on education and trying to find a better way to make sure that long-term damage isn't actually happening.
Yeah, great, thank you. I've had another question come through from Jessica McKenna from KidSafe, who was asked, is there a difference in concussion signs and symptoms for children and adolescents compared to adults?
There can be. There's actually not a lot of studies comparing children and adults in the same study. There's a lot of child studies and a lot of adult studies, but not ones comparing it in the same cohort study. Children often tend to go a little bit more quiet. So they tend to they can't always articulate what is going on. So you might see them become more withdrawn and kind of almost more clingy in that sense, versus adults can articulate, I've got a headache. In terms of actually what they experience, it does vary depending on, it does vary depending on the person, and it can vary for the person between events as well. So no, there isn't a clear cut, children have this and adults have this. It's just how they present it a little bit more.
Great, thank you. I guess looking at age groups, now looking at sex. So are there any sex-based differences in concussion risk and outcomes?
There's a few different things. So this, great question, because this is an area I was thinking could end up going down a tangent if I start discussing all the things. There's a few different things. There's been thought that females are more susceptible to concussion than males, but there's a lot of other variables that we need to control for when we're looking at why is it happening. There is the thought that females are more likely to experience the emotional side effects of concussion. But whether or not that just comes down to females kind of being more open and more willing to articulate that is another question as well. So in terms of actual black and white differences, not necessarily, and it does depend on the individual, but it also can come down to how people are more open to expressing or also recognizing within themselves.
Yeah, thanks. Building on that question, I have a question come through from Mark Middleton, who's asked, what is the latest research advice around female concussion? I note some reports that the symptoms last longer, noting this presentation has a bit of a focus on male sports participant examples.
Yeah. So female sport with concussion is still kind of starting to come out in the recent literature. So a lot of the stuff is taken from males and then generalized to females. So there is a big call at the moment to get more female specific research, and not just female specific, just comparing it to males, actually give them their own space and their own time to have a look at what's going on. Because often we just apply the template of male to female.
Mm-hmm.
In regards to females with their symptoms prolonging, yes, there is evidence saying that females do experience symptoms sometimes for longer. There's also the thought that are females more willing to report it for longer as well, which we need more evidence to actually tell us this information. It's also negatively stereotyping males that males aren't willing to report or things like that, which isn't always the case. Some studies out of America did have a look at females, once again comparing them to males, and it showed that they were more likely to experience anxiety and depressive states. But it also showed that a lot of these student athletes had pre-existing anxiety and higher stress before going in, and that was found to be a direct correlation between anxiety pre and experiencing anxiety afterwards. So there's a whole lot of confounding things. And at this stage, it does appear anecdotally like the females are experiencing concussion worse, especially if you look at female AFL. But perhaps if we have a look at how long they've been playing the game for, because a lot of them have come from other sports, perhaps there's also a whole range of other factors going on as well. So my background has been in male sports, so you're 100% correct that it is got that little bit biased towards male sports. So I can't 100% speak on females, but in terms of that, there does appear to be evidence saying that, yes, females do to a certain extent differ, maybe in time, but why that is exactly, we need to tease it out and give females a bit of their own space in research.
Future opportunities.
Yeah.
Thanks, Sarah. I've had a question from Kirsty Spadassini. Sorry about the pronunciation. Does Sarah hold webinars or face-to-face talks with children about being aware of concussion symptoms and giving children the courage to speak up and tell an adult?
As in, do I or will I? Sorry,
maybe a little bit of both.
Not currently. Yeah, education with students. Some of the private schools do concussion education with their students that engage in sport. I'm not sure about all the different clubs and things. Previously, in my different roles, I have definitely delivered education to parents. That's probably something that Lauren and I need to speak about in terms of delivering to children. One study that came out of America, depends what you mean by child as well, because a lot of the research looks at delivering it kind of to that 12 to 17-year-old as being child. And that found that by educating them, they then knew what not to tell you.
Oh,
But perhaps if you can start that education process at 5 or 6, that might see that kind of systemic change and reduce that stigma that they might develop as they get older and a bit more competitive. I definitely think, yeah, that's a discussion I'm willing to have. And Lauren, who's my boss that's on here right now, we can have a chat about that later.
great. Thanks, Sarah. That's really interesting. A question generalizing concussion to all injuries. Do you treat other concussions like at home or an older person falling the same as sports concussion?
Yes. The difference with concussion external to sport is that people don't see it in the same light. I mean, I'm sure if I was to ask people to raise their hand, if you've stood up underneath a shelf before and cracked your head, or you've hit your head on the car door and you've gone maybe seen stars for a couple of moments, and then had a headache and a bit of a lump on your head, for some reason people don't consider that concussion and they carry on with their day. Falls often is attributed with something else. They've also injured something, so they get medical attention for the injury, and then it also comes about with the concussion. And that comes to light. The hard thing external to sport is a concussion. We can't, if it's not a bleed on the brain or not a skull fracture, we can't treat it. So we kind of say rest and then gradually return to exercise. So to assuming that it is a standard injury where they're not having ongoing symptoms, really rest and time is all that we can prescribe. So in terms of how we manage it, I think that's kind of why there's probably not as much information out there about falls. I did actually want to try and find a falls resource to share about elderly and concussion and return to life, but there actually wasn't anything that I could find when I was trying to have a look today. So that's definitely something to consider as well. Often when someone presents to hospital, once they clear it from being anything to do with their neck, anything to do with being a skull fracture or any kind of intracranial bleed, we often kind of unfortunately forget about that and then treat the other more primary injury that's there. So yes, we should treat it the same in terms of get them slowly recovering, making sure their symptoms are decreasing and not ongoing, making sure they're not spending a lot of screen time, not driving, not drinking alcohol, all these kind of things that can compound. But in terms of, you've seen all the different, I mean, I showed all the different resources there are for every single sport. Not so much when we start talking about things like falls, motor vehicle crash or domestic violence, unless it starts going into that more severe traumatic brain injury.
Yeah, okay.
Did that answer the question?
Yes. Yes.
Okay.
Thanks. Final question. What is the most important next question in concussion research to answer?
Oh. Well, I think we're doing quite a good job at asking what is currently happening and what does happen. I've always been quite interested in what are the risk factors, so what predisposes groups. And I personally am quite interested in differences in personality and things like that, only because I have seen kind of you go get a player. I used to be able to almost pinpoint who's going to be my concussion kid for the year based on how their behaviour. And they'd be the same kid that, you know, would do a backflip off a roof and couldn't work out why they got injured. So that kind of risk-taking personality where they just didn't seem to think before they went for the ball. But that's me speaking in a football context. So I've always been quite interested in that personality, if that does play any role. I'm also interested to see how females and males do recover following and actually looking at them together, as well as children in that same cohort. So in terms of where to, I definitely think with technology, things are going to improve in terms of how we diagnose and how we tell when someone is fit to return. Completely outside my scope, but I also hope it will kind of answer a few more questions down the track about mental health and about these long-term things that we're seeing, and if we can identify them early and have any early intervention, and whether or not concussion does directly cause all these negative things that we're hearing, a bit more clarity kind of around the role it plays. but that's very far out of my scope. I'm not a neurologist.
A lot of opportunities there for future research.
There's 1,001 questions that I'd like to see answered in the future.
Well, hopefully you get the chance. But thank you, Sarah. Thank you so much for taking the time. You can really, like I said, you can really see your passion on the topic come through, and so extremely knowledgeable on the area. So I hope everyone was able to, take different pull out what they need from that presentation and be able to apply it to their role. What I'm going to do is just
as I said, I could speak all day on this. So if anyone does have any questions, please feel free to flick them through to me, and I'd love to answer them. I have just done kind of a brief overview of everything. So this is a topic I could chat everyone's ear off for hours if given the chance.
Thank you. I've just grabbed the screen back off here. I will wrap this up. Sorry. Great. So looking at next steps, Sarah, you've already covered a lot more resources than this, but this was just a few different resources that I pulled out. The one on the left there, the 10 years of sporting and recreational injuries, that is from Royal Perth Hospital. I referred to some of their stats at the start of the presentation. The Concussion in Sport Australia position statement, Sports Medicine Australia as well. Sarah kind of covered this, has some great resources there as well. If you haven't already, I encourage you to jump on their website and take a look. And the Australian Institute of Health and Welfare earlier on in this year released the Hospitalised Sports Injuries in Australia 2016 to 17 report, which includes information on head injuries as well as all other sports injuries. So if you're interested, I'll send out some of these links as well as the links to the resources that Sarah has talked about. Next steps, a few different opportunities to keep the conversation going from today and to be talking about injury. The Injury Prevention Network, it's a group that meets quarterly to provide practitioners across WA with an opportunity to connect with each other, to share their learnings and solutions, injury prevention and community safety and recovery. You don't have to be based in Perth to attend. You can do that through video conference. So if you are interested, I'll send out some information in a follow-up email. Get connected. It's an opportunity for people to build their professional network and to keep you in today's conversation. It's a networking program whereby participants are randomly paired bi-monthly to have a 15-minute conversation with another professional working in the space. I think programs like that are even more relevant today with COVID-19 and social distancing and everything else that's going on. It's, I guess a phone call away. And as I said at the start, once the webinar finishes, a SurveyMonkey will pop up. Please take a few moments to complete the survey. We really greatly value and appreciate your feedback. Upcoming training and events. We should have a few more events coming out this first half of the financial year. If you have signed up to the No Injury e-news, keep an eye out in the Learn section, and over the coming weeks you'll start to see a few more of our upcoming events. And that is all for today. So big thank you to Sarah. Greatly appreciate you sharing your knowledge with us, and thank you to everyone else for listening in, and really hope you were able to take something away from this presentation today and apply it to the area that you're working in. I will send out all the links and information that was referred to in this presentation, so please keep an eye out for a follow-up email. But great, thank you everyone. Thanks, Sarah.